I am so incredibly excited about today's conversation. It is not only with one of the world's most renowned physicians who studies stem cells, it's also a close friend of mine. I am so pleased to welcome Dr. Nathan Newman here, who is a world renowned pioneer in stem cell therapy and cosmetic surgery. He's known for creating the transformative stem cell lift, which we will dig into, technique. With over 25 years of experience, he's dedicated his career to advancing regenerative medicine, using innovative methods to rejuvenate and heal the body. As the founder of the Orchid Surgery Center in Beverly Hills, California, Dr. Newman has developed cutting-edge treatments and globally acclaimed skincare products. Trained at prestigious institutions like USC, Albert Einstein College of Medicine, and UCLA. He's a board certified dermatologist, inventor, and international speaker, recognized as an authority in stem cell applications. Join us as we explore his groundbreaking work and its impact on wellness and beauty. Dr. Nathan Newman, I am so excited that you're here today. I absolutely am such a fan of your work and am so invested in what you have been doing in the world of stem cells. And I'm excited to share it with our audience today. So tell me a little bit of your background and how you ended up in this kind of unique sector of medicine.
Yeah, McCall, it's my honor to be here with you in the podcast. I love everything that you do. And, my whole path to medicine was about education. I knew very early on I wanted to become a doctor because that's sort of in my DNA. Everybody in my family is doctors. My father, my grandfather, my brother, everybody's a doctor. So when I went to medicine and I started learning, I enjoyed learning about the skin. So I did dermatology and I became a skin doctor. But then in that sort of path, I learned that I enjoy cosmetic stuff. So I went and did cosmetic surgery. And then during this whole process, I was doing a lot of work with fat. At that time, we just figured out that fat contains the most amount of stem cells of any tissue in the body. And I started trying to figure out how to sort of utilize that fat, how to get that stem cell and use it to improve the fat grafting, to do all the things that we were doing with fat in terms of cosmetics, in terms of reconstruction. And that's really led me to a 25-year path of stem cell research and therapy in my clinic and in my laboratory.
I mean, 25 years is a long time for stem cells. Like, I feel like I was curious about them super early on, and it was not 25 years ago. There could not have been that many people doing stem cells back then.
No, I was one of the first few that was using autologous stem cells from your own body. Before that, everybody was using embryonic stem cells for research, and they were using maybe some, bone marrow for bone marrow transplantations, and that's where we get most of our data from, is from that treatments of the bone marrow transplantation for cancers. But we took that data and we applied it to the stem cells that we got from the fat because they happen to be the same kind of cells. And that really helped us accelerate what we do and the research that we do.
Wow. Yeah, that's incredible. Take our listeners and people who might not be familiar with stem cells and what they are and where they come from. Tell me a little bit about what a stem cell is in general.
So stem cells are basically the cells that regenerate and renew you. What keeps you alive, right? When we're born through an egg and a sperm coming together. That's the first stem cell. That becomes a whole being. From there, as the baby is growing and is becoming sort of differentiated into different parts of the body, every part of the body maintains a little bit of those cells that can continue to regenerate those tissues so that your ability to maintain your healthy tissues alive throughout your life is there. So your hair grows because of stem cells. Your skin grows because of stem cells. Every organ in your body is turned over and made anew at different rates so that the person you are today is not the same person you were 10 years ago. No cells in your body 10 years ago are alive today. They're all
Wow.
regenerated from stem cells. So
Wow.
in order to stay healthy, you need to have good stem cells. And in order to stay young, you need to maintain the overturn. So the amount of tissues that is sort of falling or dying or not functioning has to be replaced at the same rate, at the same pace, with your own stem cells that will replace them. If that doesn't happen, things start to break down and you start aging.
Interesting. And do we start aging more because we lose access to as many stem cells as we get older? So the rate can no longer keep up, basically?
Right. So there's two things that happen. The function of the stem cells are lowered, and the ability for them to actually keep up and maintain is changed. So you're starting to see breakdown of the tissues and you start to see aging process. In injury, stem cells come in and start the repair process. So if you can get enough stem cells, you really repair well. That's why kids can fall down and get up and go and nothing happens. And when you're 80 and you fall down, not so easy to get up and go. So those things are always part of it. But the amazing thing is that not all the tissues have the same amount of stem cells, and not all the tissues have the same ability to use those stem cells. So in your bone marrow, your height of your stem cells is when you're very young, when you're a baby, and by the time you're 20 or 25, almost 30 to 40% of them is gone. And in the tissue and the fat, it stays. So in your 80s, you still have it in your fat, versus in the bone marrow, they're pretty much gone.
Wow, I did not know that. That is fascinating. And tell me kind of what are the different types of stem cells, like generally speaking? Educate us a little bit.
The first type of stem cell is the embryonic stem cell. The embryonic stem cells are the stem cells that are able to create a whole human being.
Mm-hmm.
Those stem cells are directed through the interaction of the cells and the environment to become a human being. Once you get past that, you get the cord blood stem cells. So the cord blood is a unique place where the only time you can get it is during pregnancy. That cord blood has cells in it that you won't find any other time. And then you have tissue stem cells or adult stem cells. And those are found in different parts of the body, in the bone marrow, in the fat, in your skin, in your liver, in your hair. And those cells are there to just repair and to maintain the tissues healthy. And until now, all the embryonic stuff was very controversial because of the ethical issues that come along with it. But besides the ethical issues, as doctors and scientists, we don't know how to control that. So a lot of times when they were using embryonic stem cells to treat people, they would end up growing hamartomas, which is the stem cells were trying to create a human being within the tissue they were put in. So you would end up with hair and teeth and other things that don't need to be there. So it was a problematic, thing that you couldn't really overcome so easily. Then there were the tissue stem cells. When they came about, now we were able to do a lot with bone marrow transplantation, and that really revolutionized how we can treat somebody with cancer and save them. But the problem with that is that it wasn't your own. You had to get it from somebody else. So you had to make sure that they match, and there was a lot of problems. If they don't match, the body can start to attack itself. So with the autologous cells, with the cells from your own body, now that we can get it from the fat, it's a big game changer, because now I can do anything I want to you with your own cells in terms of using it for cosmetics, using it for autoimmune disease, using it for injuries or post-cancer reconstruction. And they're doing a lot of research trying to use these to manipulate the immune system to cancers or to treat cancers. And it's really, we're looking at the next generation of medicine, because this is transforming medicine like nothing has ever done before, since maybe antibiotics and the computer revolution with imaging, that we never had these abilities to do such great changes.
I firmly, firmly believe that. And I think one big thing I want listeners to understand today is, like, especially people who are around my age, a little bit older, when they hear stem cells, they immediately think about highly controversial embryonic cells. What percentage of stem cells that we use readily, that are readily available to like the American people today, use embryonic stem cells?
Almost none of it.
Right.
I mean, the whole industry has changed. Medicine has changed, because what you can do with adult cells is very different than what you can do with embryonic. Embryonic is trying to make a human. Adult stem cells are trying to correct whatever is damaged in terms of, is it fat? Is it bone? Is it muscle? So if you put that stem cell in a bone, or if you put that in a muscle that's injured, it will just pick up the signals and it will heal it, because they have this radar. They know what the damage is and they'll heal it. For example, I inject the knees. Meniscus is a cartilage. We can't heal it with anything. So the time that we are able now to put stem cells into a knee, and it goes and picks up that tear in the meniscus, and that cartilage is healed, that's changing the whole industry. Now you don't have to have a big surgery to do it, because the stem cell can heal it. Does it work 100% for everybody? No, because we're still learning as we're doing these things. But if we are way ahead of where we were 20 years ago or 10 years ago, even 5 years ago.
Yeah. I think more people are becoming more familiar with these sort of concepts, honestly, because they're being so used. And like you mentioned, for like joint issues, injections, PRP, exosomes, stem cells. Tell me about the differences, because I think it'll create relatability for people to understand a little bit more about it, because I'm sure they've seen ads for this kind of thing. Tell me a little bit about, like, let's say the stem cells that you use versus what they would get in a random orthopedic office, or exosomes, et cetera.
So everything I do is autologous. I like to use your own cells to treat you. A lot of people don't either have the knowledge how to do that, or they don't have the place to do that. So most people are just buying cells from a cell bank and injecting it. Now, the things that you mentioned, PRP and exosomes, are actually not stem cells. They are the language of stem cells. They are using factors that are being released by stem cells that direct the other cells to do their function. In fact, we think most of the action that happens with stem cells is from what the cells are releasing, and directing everything around them to do the job that is needed, because the stem cells are sort of like soldiers, and everybody around them are coming to work. So think like if you get a wound, it's like a construction site. So you need somebody to come and direct everybody and bring them in. So you have the macrophages, and you have platelets, and you have stem cells, and you have the immune system coming in, and you have reparative cells. You have things that generate collagen, and you got to take away the damaged tissues. So all that is happening because of this communication. Mm-hmm. So they know, okay, we did this, go to the next thing. We did this part, go to the next thing. That communication is done through the stem cells. And the environment that they're in dictates to them what they're doing. In fact, in my clinic, as I was doing all these treatments, I saw how amazing the changes are in the skin very quickly. Like within a matter of weeks, I was seeing skin become, glowing again and rejuvenated. And I'm like, this is not a cellular change, because cells take months to become part of the tissues. And I was seeing these things so quickly, I realized that it was the actual cell secretions that were causing these changes. And then I started looking into those in my lab, I opened up my lab, I started researching all of these factors and how they're released and what's the language, how do they talk to each other, and what environments do they need for those things to happen. And we really realized environment matters, and that where we take the cells and how we grow them makes a big difference. So we actually went down this path over the last 20 years, and we developed a patented process where we can take any cell, not just human cell, but any cell, including plant cells, because all cells, living things, have stem cells. That's how you renew yourself. So even plant cells have those language, and the language is actually a universal language. All cells speak the same language. They may speak a different dialect of language, but they all speak the same language. So they all understand one another. So if I take the factors from a plant and I put it on a human cell, it will have effects on that human cell and do what we want it to do. So the fact that we've sort of unlocked this language and we are able to direct it, we call it consortia factors, because it's the whole consortium, is the entire sort of set of directions that we are able to get and give it to on the cells to do it. It can be topical, it can be injectable. So that's very important. Everybody else is a little bit behind from where I've been because I've been doing it for a long time. But platelets have been used for generations. This is like a 30 or 40 years of platelet use. So PRP is not new. But the uses of PRP have grown. We're doing a lot more with it. Exosomes, it's sort of taking the chicken soup, the consortia factors, which is everything in it, and saying, no, I only want the carrots. That's what we're going to do. So they process this sort of set of directions, and they only choose the words that are 3-letter words. That's it. So everything else is gone. And your body is supposed to figure out what to do with that. So it doesn't really work. The other problem is exosomes are processed. So when you process it, you're breaking down all the proteins, you're breaking down all the good stuff, and then it doesn't have the same effect as if you had it naturally in a holistic manner that is produced by the cell.
Right. And then even like, so obviously PRP is not the same as exosomes. Exosomes are not the same as stem cells. And then to take that one line further, and this is kind of the conversation I have with people when I talk with them about stem cells. They're like, oh yeah, well, Joe Schmo down the street from me, he offers stem cells in his practice. You know, I really want people to understand too, the difference between stem cells that they're just going to go and get from a bag into an IV from a person that just adds this as a service compared to you and higher levels of stem cells. What are sort of some of the differences in quantity or quality or effect or anything like that?
Well, the fact that we are taking autologous cells that are fresh in the clinic, it means that you're getting your own cells without any of the risks of having viruses or other contaminants in the product, because those products that are not yours, somebody took it from a placenta or some cord blood or something that was somebody else's cells and grew them in a lab somewhere and giving it to you. And the problem is that these things are not controlled so well through a regulated system. So it's the sort of the Wild West, and everybody's doing all sorts of things. So if you don't know what you're doing, you can have a lot of problems. In fact, there was a doctor who injected stem cells with calcium hydroxyapatite, which told the stem cells to create bone, except he was injecting this in their eyelids.
I heard about this.
Ended up having clicking sounds in their eyelids. And everybody went and said, oh my God, stem cells are terrible. And I'm like, no, stem cells did exactly what you told them to do. You just told them the wrong information.
Right.
You don't need a bone in your eyelid, right? So don't put calcium hydroxyapatite with your stem cells. But that comes with knowledge and experience. That comes with having these things that are very, very potent cells and being able to use them correctly is a tool. And if you don't know how to use that tool, it could be a problem. And I think it's great that everybody's coming around to the idea of stem cells. I'm very happy about it because 25 years going to conferences and telling doctors, let's do this. And they're like, hocus pocus, that doesn't work, you know? We're coming around. So the fact that they're doing exosomes, that the fact that they're getting stem cells from somewhere, it's good that they're in that direction. But I think still nothing beats your own stem cells. You can get it as much as you want. So if you need it for a large area, I can get more. If you need it for a small area, I can get less. It's fresh, so it's not frozen, it's not damaged, it's not. So that you're getting the best quality of cells with the least risk, and you're able to really see how much it benefits you. And every time you do it, so sometimes you have to do it more than one time for an autoimmune disease because you're trying to correct a problem that's internal. And the repetition, it sort of builds one on the other. So you do it one time, you get 50% better. But the second time, you get 50% from there. So now you're 75% better. And the third time you do it, you may go into remission and not have the disease. So these things are not being widely used the way I do it because the fact that I have the surgical and the dermatological and the basic science background, I've been doing this for a long time, it sort of sets me apart. And I don't blame the other doctors for, buying a ready-made product because you need to have a lot of knowledge to do it. But to buy the product and inject it, it's much easier.
Totally. I love it. Tell me some of your favorite ways to use stem cells in your practice.
So I use stem cells for cosmetic purposes, so I don't cut and pull anymore. Facelifts are sort of, in my mind, have evolved. We have a lot of technology, not just stem cells, but we have radio frequency devices. So if you combine these, but if you put the stem cells, now you're able to regenerate what's lost. You're able to bring back the blood flow and the collagen and the matrix and the glow and the elasticity of the skin. And you cannot do that by cutting and pulling. So I refer to it as bringing back the grape. When we age, we get sort of wrinkled and everything gets shriveled and you become a sort of a raisin. But if you inject stem cells, you're going to get the grape back. If you just cut and pull it, that grape just becomes smooth. It doesn't become back into a young, juicy fruit. So that's one thing. The other thing I love doing is post-cancer reconstruction because it really is transformative for people, treating people's tissues that could not be repaired otherwise. We're really able to do a lot of improvement in their tissues, and that's really where I got my passion for it, for stem cells, and I became a big believer in it. I use it for autoimmune diseases like lichen sclerosis. Lichen sclerosis is an autoimmune disease that affects mainly women's genitalia. It's a terrible disease because it's something that happens and is misdiagnosed for many years in many cases, and women suffer miserably. Unfortunately, not a lot of research is done on it, so most doctors don't even know about it or don't think about it to diagnose it. And even if they do diagnose it, there's basically, here's a steroid, good luck, and that's it. So I had a patient who called me and said, I heard you did this thing, and I know that there's this doctor who's doing something in Europe doing it. Can you do it? And I thought about it, and I said, of course, that makes sense. Why don't we try it? And I started injecting the stem cells into the tissues where the autoimmune disease is. Before I was just trying to give some comfort and relief to the patients. And today we're in a completely different place. I've treated over 350 patients, and a third of them are in remission. That means a third of these people don't have the disease. They don't use medications. They don't have to deal with it. They have a normal life. And the other 2/3 are significantly better, like 80% better. So once in a while, they need to use their creams, or if something is triggering it, they need to use some of the creams to maintain it, but they are not restricted from having their life. These women can't sit down, can't wear underwear, can't wear pants. I mean, it's a very, very uncomfortable thing. And it's in your private, it affects your marriage, it affects your relationship. So it's a very very important thing for me to be able to help them. And
Yeah.
then the last thing I do is joints and injuries, muscle injuries, joint injuries. And, I've treated athletes, I've been treated young people. And if one of the things that I love is that I can save people from big surgeries. I had a kid who goes to my kid's school, got injured on the basketball court. His friend had to have surgery. 1 year out, they can't play. For a whole year, they have to be in physical therapy and going to. And he came to me. I injected him. 2 weeks later, he was on the beach going with his father on vacation. And he's not doing sports at 2 weeks, but he's walking and he's having his life. He's not on crutches and walking, in a wheelchair. And he was back on the court 6 months playing, and he won the championship. So it's life-changing. And if you want to have that sort of an improvement in your life, you have to embrace this technology.
Yeah. And I mean, I even just hearing you talk about the lichen sclerosis thing, I've had so many patients, not so many, but quite a few with that. And I get really vulnerable with my patients. Like, we really go deep, and the devastation that condition creates physically, but emotionally, interrelationally, like all of those ways. And really, they never had another option truly to feel any sort of relief. And so what incredible, incredible work, and how fascinating too that it's in the autoimmune sector, right? Like, in a sector that medicine really hasn't invested enough in as far as fixing, outside of, hey, immunosuppressant kind of things. What ways do you see stem cells being able to influence or play a role in autoimmune conditions?
I think stem cells are going to change autoimmune disease because there's a misconception about what autoimmune disease is. A lot of time we think is an immune dysregulation, which means that your immune system is not working correctly. I don't think that's correct. I think the immune system is working properly because you don't have the disease everywhere. If you had a disease everywhere, yeah, maybe the immune system is not good. But if it's only that thyroid, or it's just your genitalia, or if it's just your joints, then something in that tissue, something in that area is probably signaling your immune system to say, hey, I don't belong here, or this cell doesn't belong here, come and get rid of it. And you get that inflammatory response because now your immune system is attacking the cells that thinks is not supposed to be there. So I think one of the great things with stem cells is that it has the innate capacity to correct that. It goes in there and corrects that missed signal. It corrects the signal that's on the cell. How it does it, we don't know. What the signal is, we don't know. We have to look at those and we have to figure those out. And if we do, we can cure it all, right? But we're not there yet. But we have the ability to use the cells that God gave us and just does this thing naturally, put it in the right place, and it'll, if it doesn't correct it all the way, at least it will give you so much improvement in the tissues that you can live in a comfortable way. Mm-hmm. So if you have rheumatoid arthritis, and I've injected a lot of joints with rheumatoid arthritis, it really changes the person's life. Now they can use their hands. They're not in pain, constant agony. If you have, the tissue diseases like lichen sclerosis, lichen planus, lupus, all these things that are in the skin, that's easily accessible. So I can inject those areas and you can do it. The problem comes, what happens if it's an autoimmune disease like thyroid? Mm-hmm. How do I get the cells in there without causing damage to the thyroid, right? Because now I can't inject a whole bunch of cells into a thyroid. It's not so easy for me. And I'm not sure if it will do the same thing as it does in the rest of the tissues. So a lot of people have tried IV therapy, so injecting cells into the bloodstream. The problem with that is that you're taking cells, concentrating them, and then putting into the bloodstream. Now you've diluted them back, and only a very small fraction of them end up in the thyroid. Mm-hmm. You may get some improvement, and most of the IV therapies say, okay, even if you get improvement, it's good for like 3 months, 6 months. and then you sort of go back. And I think the reason for that is because during that time, you're getting all those factors that
Mhm.
the cells are releasing are improving your condition. And once those cells sort of die off after 3 months, or they get incorporated into the tissue, that's it. They're not producing the same factors, the same signals, and the effect goes away.
I wonder if we need to do a study for thyroid people, you and I partner and see if we can influence. Because the cool thing
I
about
would
thyroid
love
is
it.
it's so hard, but it's measurable, right? Like we can measure antibodies and see how they're being impacted in an objective way, which, you can't really do for other, like, lichen sclerosis or that kind of thing. So, gosh, it's something to definitely consider.
Yeah, I like that.
Yeah. So I know one of the unique things that you do at your practice involves consortia factors. I want you to reiterate and tell us a little bit about what they are, how you use them, and what all you do with them.
Okay. So I realized that the stem cells produce these language, and we went to the lab and we started researching them. We figured out how to grow these cells in a way that every time we grow a cell in a specific manner, it gives you a different set of language, a different set of directions. We call it the consortium factors because it's the consortium of peptides, exosomes, small molecules, growth factors, wound healing factors, anti-inflammatory factors. All of these things are being produced. It's just what is it being, how is it being put together? What is this sort of, when you read the paragraph, what is it saying to you or read the
Mhm.
sentence? What is it saying to you? That is what's unique. And we're able to do that. So that consortium factor is what we've patented that process. And we are about to submit our IND to the FDA for burns, for second degree burns specifically, because I've seen amazing things
Wow.
happening with it. And the reason I can see why it works is because we created that product as a wound healing product. And what happened was I needed to sort of figure out what to do with it. And we were seeing that it was improving the skin. So we said, why don't we use it for cosmetic purposes? And lo and behold, it transformed the skin like nothing else I've ever seen. Within a month, you put it on and you see your skin improving. And you're like looking at this thing and going, how is this happening so fast? And what we did was we produced a product and we started selling it as a cosmetic. And as people were using it, I was getting anecdotal reports from people who were using it and calling me and say, hey, I got a burn, I put it on and it's gone. And look at this and showing me pictures. And then we started to really test it in the lab. And we developed a specific consortium factor for burns. And all the testing that we've done in the clinic and in the laboratory is really mind-blowing to me. Is changing what until now has been basically use silver nitrate as the only medicine that's around for the last 50 years. There are other products that have come from biologics, but they're not using the signals. They're using the scaffolding. So they get rid of all the cells, all the signals, and they use basically the collagen matrix to put it on so that cells can grow into it. Right. But you don't have
Oh.
the signals, you don't have the cells. So I did the opposite. I went and I looked at what doesn't exist.
Mhm.
What doesn't exist is those signals. So that's the first thing that I think is gonna come to the market in the FDA world, and it's gonna really bring us to the next generation of wound care and skincare and also some other things, because I can probably use the same language to inject it without the cells to heal your muscle, to heal your bone, to heal your joints or skin or whole bunch of things that we can't get to with cells, and we can now get to it. So maybe doing subcutaneous, just like we do with the GLP-1s for
Mhm.
weight loss, right? So all those things, we know those signals, once you put it into the body, it sort of is a domino effect, and it gets what we call paracrine effect. And every part of your body starts reacting to the signal. and it's amazing. So I think that's where we're going to be. In the meantime, I've created a cosmetic product line called STEM, and we call it STEM Natural Intelligence because STEM stands for Science, Technology, Education, and Mentoring. And that's because we want to bring this and educate the people about what they can do. It is no longer the generation of anti-aging medicine. We're in the prime of regenerative medicine. So we should have regenerative skincare. And this regenerative skincare is going to replace most of the harsh acids and chemicals that we were using. So with one STEM product, we're going to probably replace 6 of your other products and get much better results with a lot less irritation, a lot less damage to the skin. And I think as people learn about this and we bring awareness about this is from stem cells, it will also translate to their health. It will also translate to everything else that we do. We'll bring about supplements that are stem cell based. We'll bring about hair care products that are stem cell based. And it will transform everything that we are doing so we can live a better life, a longer life, a healthier life, and a more optimized life.
I have to add in my own little experience with STEM. So I've been using STEM since September, and listeners know that I invest a lot into my skincare in terms of time. I put effort into it. I actually really enjoy skincare, which is honestly why I ended up talking about it so much on social media. So already I feel like I had a very solid skincare routine. And the only thing I changed starting in September was I added in STEM. And I had a lot of redness, like almost like a rosacea type redness that I spent a lot of time, pain with lasers trying to treat last year multiple times. And maybe I got like 10% improvement over 5 treatments, which was probably $2,500. It was so sad and a lot of pain. Since I started STEM in September, not only have I noticed like reduction in my like fine lines and wrinkles, just so much more even like skin texture, my redness is gone. Like, I mean, I literally went to an esthetician last week and she's like, well, yeah, you don't really struggle with any like redness and things like that. I'm like, oh my gosh, if you only knew, sister. Like I was the most red Rudolph. Any little thing would set it off. So that's completely gone. I use it religiously too on little rashes and things that again were really bad. You can't even see them if you're watching. So I'm a very big believer in STEM. I love it. I use it twice a day, every day, and will not stop. Tell me your goals in making STEM and making the skincare line.
So it was actually interesting how we made the skincare line because throughout the years, I've made different types of skincare lines. And we realized very quickly that because the technology is so new, that we have to bring everything in-house. We have to create everything from scratch. So we actually developed the whole process from the cell, the actual stem cell from the plants that we choose, to the bottle. Everything, including all the formulation, I do myself with my team in my facility. So everything is under my
Which control. Never happens, by the way.
Right. This is unheard of in the industry.
Right.
and when I tell that to people, they're like, what do you do? So, but because of that, I know exactly what goes into your product. And I know what it's going to do for you. And I know which product to give to you to get sort of the best results for you. And that's what we created the stems line, and the serum is the base of all that, and that's what you're using. And then we have, things that will work synergistically with it. So we have the moisturizers and the sunscreens and the wash to keep your microbiome safe and keep your health of the skin. Because most of the things we use is actually very harsh on the skin.
Right.
And I think the less harsh we are, the better things are. Because what we're giving you with the consortium factors that are found in the products is what the skin needs. Is it not just the directions, but also all the resources. Mm-hmm. So when you don't have the resources, you can't do it. So if you have the resources, your body will actually be able to take it and use it and improve itself naturally. And our goal is to get everybody thinking about stem cells. Know that this is here and you can use it today to benefit you. This should be something in everybody's household. It's not something only for the rich. I don't want to make a product that's $500 and nobody can use it, and just the elite can use it. I could have done that, but the technology that we have should not be in the hand of the few. It should be in the hands of masses. This should be in everybody's house, and everybody should benefit from it. Not just for cosmetic. There's also all sorts of other things for inflammation and for hair, and there's a lot of things that's coming for your health. And I think we're just beginning this path, and the skincare is the easiest for you to see the changes,
right,
and see the power of this technology.
Right. And tell me a little bit. Tell me what makes it, one, I want to know a little bit about what makes it unique. And I already know the answer to this, but I just want you to say it out loud. And then two, one question I always get from people is it clean? So tell us about both of those.
So like I said, that we are doing the whole process from the cell, the actual plant stem cell, to the bottle. So I know exactly what goes in it. We make sure there's no phthalates, there's no parabens, there's no silicone, there's basically nothing that is going to harm your skin, because most of the things either are toxic or are damaging your microbiome. There's a lot of antibiotics in a lot of these things, or alcohol. So we don't use any of those things. We use the most pure natural things as the cell makes it. So we are the only product also that has so much active ingredient in it. It has more than 85% of the serum is actually active, or not active, but they're the key ingredients that are making all the improvements in your skin. So these key ingredients are usually at 1% or less in most products. And because we're doing it in-house, I don't have to mark it up 50 times to give it to you. So you're getting the most concentrated amount of products at an affordable price, where you're going to see immediate results. So like you will see the change within 1 month on your skin. And that doesn't happen with anti-aging products or with the other products.
Totally. And I'm sure you can see the initial responses in a month, and then they just build and go deeper and deeper and deeper as it integrates more and more just into your physiology, right?
Right.
So
because
I use
factors, talking to you is a dialogue. It works with your body, not at your body, right?
Right.
So most of the things that we're using, like vitamin C or retin A, is giving one signal. It keeps saying, make collagen, make collagen. At one point, the body says, listen, I've been hearing this all day long. I've made enough. And you get what's called a negative feedback. You actually say, I've done too much of this. Let's break it down. That could happen. Sometimes when you use too much retin A, you see some people get a little bit thin skin. They're smoother, but they're thinner. With this, it doesn't do that. With this, it's a dialogue. So it takes what it needs from this consortium. All these natural peptides, all these natural factors are in there. And whatever it needs through that dialogue, the body will use it. The resources, the vitamins, the minerals are in there. Whatever it needs, it takes it. Today, you may need it at this level. Tomorrow, you may need less of it. So it'll just take less of it.
It's so fascinating. I use a lot of stem products myself. Like I just because there's so many different roles, like many of them have different purposes. So I keep them all pretty handy. But if someone wanted to start and try one or two products, I know which ones I would recommend, but which ones would you recommend?
I think everybody should start with the serum, because that's got the majority of, that's the powerhouse, right? You use that, and everything else is to support the effects of the consortium factors in the serum. So you wash your face, you put the serum on, that should be the first thing that goes on your face. And then you want to lock it in and moisturize the skin. And I will use our night cream to do that. And that will give you, because now it's cold and dry, and people like it a little bit, heavier, thicker, richer. moisturizer. So that will do it. So the moisturizer also has consortium factors that work synergistically with the other factors that are in the serum. And also it works to not only to moisturize, but it also works as an anti-glycolytic. The glycation is when the sugar moieties get stuck in the collagen, and it makes your skin look leathery and harsh. If
Oh,
you ever see that
interesting.
leathery skin, that's from that. So we have products in there to actually address that specifically. So I use the serum and the night cream, and you have the start of the process.
I love it. Okay, that's what I was going to say too. I was going to say number one, serum, number two, night cream for sure. I know we have a special offer for everyone too, but before we share that with them, I have to. I have to. So originally, when I heard about Dr. Newman, I heard of him through a friend who had what's called his stem cell facelift. And I'm going to make you tell everyone about it because I saw her before and after pictures, which her stem cell facelift was like 15 years ago. I mean, she supposedly, from what I've heard from her and Dr. Newman, she looks better now than she did 15 years ago, which is incredible. But I want you to tell people because I think it's such a unique offering about your stem cell facelift.
So the stem cell facelift is using your own stem cells from your own fat to regenerate and rejuvenate your skin. What happens with aging, we lose the natural youthful proportions in the skin and everything sort of sags down. So we're able to restore the proportions that are youthful, the contour of the face. So it's really sculpting it back to where it needs to be. And the great thing about it is because it's your own cells and because we're not cutting, I can do it and you can go out basically the same day and you have a little bit of swelling, but that's it. There's really no downtime except for the swelling and if you get bruised from my numbing. So it takes about 3 months for the cells to incorporate into the tissues, and that will last you forever because now you're resetting the timeline for where you're going to age. You're going back 5 or 10 years, and you're going to start aging from that point. And you will look better in 10 years from now than you do today because those stem cells are there. Now you have a lot more stem cells to pull from. So we talked about this balance of breaking down and continuing. So if you have more stem cells in that area, you're not going to break down as fast. You're not going to age as fast. You're going to look better. Where if I was just to cut you and pull you like we used to do, that would actually be counterintuitive. It would do worse because we're cutting, creating scars, taking away blood vessels, making things thinner. And here we're doing the exact opposite. I'm bringing you blood vessels. I'm bringing you collagen. I'm bringing you the fullness, and everything is done under local. So it's safe. You don't have to go under general anesthesia. You don't have scarring. You don't have to worry about hitting the nerve endings and getting paralysis of your face. You don't have to worry about hitting the blood vessels and bleeding out. All these big risks that we had when we did the traditional cutting and pulling facelifts, those risks are gone. And the benefits are just amazing because now I can do with one procedure, I can do your whole face. Whereas if I were to do the same thing I do with stem cell lift with a traditional cutting and sewing sort of methodologies, I would have to do 9 different surgeries. It would be the forehead lift, the upright, the lower eyelids, the lips, the chin, the jaw, the mid face, the lower face, the neck. All those things are different procedures. Here I'm doing everything with one procedure and treating everything in a way that they all match so that everything is now in proportion and looks much more natural than anything else you could do.
Right.
And it ages with you, it changes with you. So with her, she had these big bags and, they wanted to cut her out. And I said, if you do that, you're going to look older because now you're going to get more hollowed out. And she's a young girl that, doesn't need it. She was in her 20s. Don't do that. I put some stem cells and it just transformed her face and she loved it. And so since then, we've been friends.
She's lovely. She's lovely. I mean, so fascinating. I mean, local anesthesia, natural, right? Like all natural, done in office, no cutting. No, it's a facelift without cutting skin. So I felt like we had to at least touch on that for sure for people. And then we have a special discount code for you all. You can get 10% off of, well, you go ahead. You tell them about.
So any product you want to have, you can go to McCall 10, which is the discount code, and go to our STEM store and choose the products that you want and that you want to enjoy all of them. I think you'll benefit from using all of them. But if you want to choose one or two, I would definitely do the serum and start with that. And once you see the results, I'm sure you'll want to use the rest of the products as well.
For sure. And if you do, tag me on social. I want to follow your STEM journey, and tell us where we can find you, where we can find more information about STEM.
You can find the STEM company. The STEM company is where you can find about STEM. And my name is Nathan Newman. So you can Google Dr. Nathan Newman or Nathan Newman MD, and you can find me.
I love it. Well, thank you so much for this conversation. I think people are going to leave here so enlightened and empowered with what I think we both agree is the future of medicine.
Yes, I hope that your listeners enjoyed listening to this and got some more information about stem cells, and hopefully it will help benefit their lives.
Agreed. I'm confident they will.
Thank you.